Yo, so for this video I thought I'd give my understanding of the masking differences between autism and psychopathy. Because both of them mask, and masking is essentially, it's masking, it's mimicking emotion, it's putting on a persona, it's a way of communicating socially and emotionally. And there are specific ways that an autistic does it and specific ways that a psychopath does it. So, as I've identified, psychopaths tend to have cognitive empathy and an intellectual understanding of others' emotions. Now, the degree of how much they understand and how much they can recognize will vary with the individual. For instance, a psychopath who's been brought up in an environment of isolation will have not had the experiences socially to form a conclusion of how others' emotions work. Whereas an individual who has had a lot of experience socially will be able to recognize others' emotions and formulate conclusions as to how to influence those emotions, and in some cases, if there is an inclination towards antisocial behavior, how to manipulate those emotions. Now, autistics, the myth of autism is that autistics have no empathy. That isn't the case. Often autistics have tremendous amounts of empathy, and they can feel emotion very strongly. But typically with autism, there is difficulty in understanding how to, on the one hand, express their emotions in the appropriate way, but also recognition of emotions in others and how to respond appropriately. So for an autistic, masking is as such. An autistic may recognize that in certain situations, people will express certain emotions. An autistic will observe this, and in order to fit in, they will mimic that expression of behavior and emotion. Now, they may not feel what is being expressed, so they might be in a social situation, and particularly if they are high functioning, you might not even recognize that they are autistic, because particularly high functioning autistics can become very skilled at mimicking the expected emotion and social response. But that doesn't necessarily mean that that is how they are feeling. And that is why autistics can experience burnout and anxiety and struggle with the fact that they put tremendous efforts in fitting in with the norm, but they themselves, for who they are not recognized. Now, psychopathy can be similar, but its core reasoning for masking differs slightly. So psychopaths will have a capacity for intellectual emotion, an understanding of others' emotions, even when they have no felt sense of empathy. Depending on the functioning levels of the psychopath, they can recognize emotions in others to a greater or lesser extent. They will then mimic these emotions in order to fit in socially and emotionally. In cases where that psychopath is a predator, it's a way of not being detected. But as I'm trying to explain and promote through my content, it can also stem from a genuine desire to communicate and assert themselves. Because they lack often the emotional, the affective, the felt sense of empathy, in many situations, socially and emotionally, they don't feel a natural inclination and reciprocation of emotion. So if they haven't learnt how to appear that they are showing the appropriate response, that can present as a difficulty, whether that's that they appear awkward or that others become concerned or even in some ways offended or feel undervalued because the psychopath is not showing them empathy or the appropriate emotional response. So both autistics and psychopaths have masking abilities, but in many situations, while the autistic may not feel the normal emotion, they do have a sense of empathy and they feel something. But the way they express their emotions differs from the norm, from neurotypicals, and they have to modify their behaviour in order to fit in with what's expected. A psychopath will lack the felt sense of emotion, but through facial expression, the language they use, articulation and body posture, mimic what is expected in a social and emotional response.